And West African nations experiencing the outbreak continue their efforts to quarantine the afflicted. CCTV's Robert Nagila gives us this update from Nairobi.
Perhaps the best way to put it is in the words of a WHO official who said that the Ebola itself is spreading faster than they can contain it. And that essentially is where the problem is. The disease has spread from country to country. We've got now 4 countries in West Africa affected. I'm talking about Liberia, Sierra Leone, Guinea, and now Nigeria, where at least one person, that is what we know of as at this moment, has already lost their lives as a result of Ebola itself. However, now we've also seen governments, the 3 governments at Sierra Leone, Liberia, and Guinea scrambling to contain the situation before it spreads even faster, albeit initially not much was done as quickly as it should have been to try and contain the situation. And that's one of the reasons why we saw it spread over the borders to the neighboring countries. Liberia, for example, this week took several stringent measures. President Salif Johnson announcing the closure of schools, all non-essential government officials sent home. And 1st of August was basically declared a holiday to allow for sanitation and decontamination of public places, government offices, and the government has also gone as far as to advise people not to meet in groups until the situation is concerned, and is now using security forces to ensure that these measures are followed through by the people of that country. We've seen more or less the same in Sierra Leone as well, and in Guinea as well. Now, in Kenya itself, you've got to remember that Kenya has never really suffered from any Ebola outbreak. We have had a case in Uganda, September 2012. Several people died as a result of that. However, the government there took some stringent measures as well and was able to contain it. Now, at that particular point in time, the Kenyan government did take several measures when Uganda was affected by the outbreak. They had medical personnel at all border entry points, and it's the same thing we're seeing right now. The government has basically sent out medical teams and equipment to all the border entry points. Now, part of the worry, especially for a lot of people here, was the fact that the national carrier, that is Kenya Airways, flies about 44 times a week to several West African destinations, and this is where we've seen an outbreak of Ebola itself. However, they've gone out to assure people, and what's happening now is as soon as you get on a plane from West Africa coming down to the East African region, you're given a questionnaire to fill out. Now, this questionnaire basically has these basically 6 certain information, trying to find out whether you have any symptoms. Now, if at all it is suspected that you may have those symptoms, you'll be isolated, and as soon as you land, there'll be a quarantine set up, isolation, and you'll be taken to a hospital immediately. So the Kenyan government basically going out and saying, look, we're on top of things, there's nothing really to worry, we've taken enough precautions to ensure that in case of an outbreak, it will not spread.